Hello, I'm Joanna. I am senior therapist at Pulse Light Clinic at Fenchurch Street. Today we are going to talk about thread veins and how we can remove them. What is a thread vein? Thread vein is like a little dilated vein that appears on the surface of the skin. Usually happens on the face. The most common area is the nose area and usually very often around the cheeks area. Sometimes we can have thread veins on our chest and also on our legs. Why are we having thread veins? I mean, there's many factors of this problem. Very often is the age. As we age, we can see more and more dilated capillaries on our face. But also sometimes very young people may have veins mainly around the nose area. This is actually the most common area that we are having thread veins. Sometimes we may have like a, which I call spider vein, which is very often like a single little, usually very obvious red spot. Very often is caused by mechanical damage. It very often happens on the nose, like people squeeze a spot or a blackhead and it causes the damage, mechanical damage of the capillary. At Pulse Light Clinic we use candela laser, and the specific wavelength for treating thread veins is non-diac laser, which is absorbed by red pigment, hemoglobin in our blood vessels. Depends on the severity of the problem. We may need sometimes just one session, but sometimes we need to do around 1 to 3 sessions, and usually the treatments are done like 4 weeks apart. Very often we've got thread veins on our legs. Legs is a little bit more complex problem because we may have also underlying problem. I'm talking about the varicose veins or reticular veins. Obviously these problems should be treated by doctors. Usually I send clients to see vascular surgeon and they need to examine the legs. Very often someone will have combination of different type of veins, from varicose veins to thread veins, and I can treat thread veins in this situation, but first the main problem needs to be addressed. So the client will go to see the doctor first, varicose veins will be removed, and then I can treat the thread veins that they are mainly on the surface with our laser. How the skin look after the treatment? I mean, there will be a little bit of redness. There could be a little bit of swelling around the vein area, and sometimes in some situation the vein may look a little bit darker. It looks like a little bruise under the skin, but this is absolutely normal and it goes away very quickly. In terms of how we should look after the skin, obviously we shouldn't do any heavy exercises, we shouldn't expose the area to the sun, we shouldn't rub the area. Just to apply aloe vera gel to soothe the skin, and in some situation if there will be a little bit of bruising we can apply like an arnica gel. But apart of this we don't have to do anything special. The downtime is very little and usually goes away with like a week time. If you need a consultation with us because you think that this treatment will be perfect for you, please give us a call. We can discuss the problem over the phone, or you can come to the clinic and then we can do straight away the test patch and then we can book you for the first session.